most rewarding part of working with patients is going through the journey with them. You meet them before surgery, you see them and you care for them in the operating room, and then you care for them after surgery and then in clinic once they've gone home. And so you go through that cancer journey with them and you kind of get to meet them and their families. And it's really rewarding to kind of see them being able to get back to their normal lives. I always liked science. I always liked trying to figure out the answers to science questions. I'm a farm kid growing up and just liked science, and I ended up doing surgery. My specialty is interesting. I'm a transplant surgeon that also does hepatobiliary surgery. So I do liver transplants. About a third of the liver transplants that we do are for cancer. And then I also do hepatobiliary surgery, so treatment of liver and pancreas cancer. So liver resections, pancreas resections for cancer as well. Liver transplants for cancer, these are for patients who have tumors within the liver that are not resectable with surgery. So that's either because the tumor is too large or too involved of the vascular structure, or the patient has cirrhosis, so underlying liver disease that makes it so that we can't remove the diseased liver. So in that case, we do a liver transplant, so we remove the patient's whole liver and replace it with a new one from a donor. We've been doing more and more liver transplants for patients with unresectable colorectal liver metastasis, so patients who are not a candidate for surgical resection. We've only been doing these in the US probably for the last 5 to 10 years, and certainly have done more and more of them in the last 2 to 3 years. It's really kind of a cutting edge area within transplant, and WashU's kind of helped lead the way in that. We have a great multidisciplinary team between the surgical oncology team and the transplant team. We work together to give patients the best care that we can. Some patients need a liver resection, some patients do better with liver transplant, and so we kind of work together to kind of find patients the optimal treatment for their tumors. Because of our multidisciplinary care, I think we offer patients more options that may not be available, and that includes clinical trials or surgery or transplant that are only available at a large cancer center like Siteman. I think the main thing is just trying to make a human connection with patients and kind of meet them where they are, kind of get an understanding of what they know about their cancer and kind of what they know about the options. And then I try to break down the surgery and the recovery in kind of the most basic terms. It's a scary undertaking for anyone to undergo a major surgery, but to try to lay it out and kind of what the complications are like and how those are treated. Just know that, and always reassuring them that we've got a great team and our team is very experienced. I always liked the technical aspect of surgery. You could see a problem and you could go in and fix it. What drew me to cancer surgery was the patients. You merely make a life-changing and lifelong connection with patients that is really important to me and something that I really have enjoyed in my career of a cancer surgeon. So I think the clinical trials that are offered through Siteman are really a great opportunity. It's kind of patients' opportunities to get tomorrow's treatments today. And it also helps us answer important questions. We learn more from every trial that we do, and that kind of helps push the needle. So every trial, we have a little incremental thing that we learn that moves us to the next trial, and that helps us build for the future. So my research is mostly looking at patients that are getting liver transplants for cholangiocarcinoma or bile duct cancer or colorectal liver metastasis. These are kind of newer areas where we're doing liver transplants for cancer. And so my research is kind of looking at kind of selection and using kind of genetic and immune markers to see if we can better select patients up front for transplant. I'm always really grateful when I see patients back in clinic and they've done well after surgery, especially if they were nervous going into it. You see them afterwards and you realize that they had a good outcome and they're getting back to their lives. That's really the highlight for me as a surgeon.